Hello everyone, this is Ryan from the future, and I want to keep this very brief so I don't waste any time. This is my VBT surgery video. I really hope you get something out of this, and I actually recorded most of this footage last year, actually all of the vlog last year, and I decided that I actually did want to upload this because before I was thinking I didn't want to. I decided I wanted to, and then I also narrated over it just to make sure that you could get as much information as possible. So do not be alarmed if all of a sudden you hear my voice and the video gets paused. That is put there just to try to give a little bit more information. Also, ignore the fact that I look like complete trash and act like complete trash. I was locked in a room all day and I couldn't really do anything. But other than that, I really hope you enjoyed the video, and yeah, that's all I have to say.
What's going on, guys? Actually, I don't know what I look like. There we go. Oh my gosh. What's going on, guys? My mom told me I should probably do a little intro because it's not going to make any sense. Basically, I'm getting this VBT surgery, and this is the intro. I'm gonna be giving this camera over to my mom so that she's able to record me with my... I'm assuming all she's gonna be able to record is me getting out of the surgery. But yeah, I'm really tired. It is 4:30 in the morning, and I already want to just go to sleep, and then I gotta do a bunch of other stuff before I can go to sleep. And yeah.
Anything you want to say?
I'm tired.
Anything you want to say? Anything you want to say?
Look at the cool IV
Let me see the cool IV.
plug. I guess it's the IV plug.
I wish I could time travel a couple hours.
Yeah.
To where it's already over.
It's Tuesday.
Yeah.
That's what I've been thinking since about Friday.
Oh yeah. That'd be a pretty cool power.
You can see if you're at a medicine up to you.
Alright, I'm turning it off. This is pre-surgery. Do that again.
Okay, Ryan, this is us waiting for you to get out of surgery. We've been here for a little while now. Just sitting, waiting, and praying for you. Watching stupid cartoons, which I don't understand why they have cartoons on the TV if you're in surgery. They should have like Netflix or something. But this is the waiting room.
You can't really see anything on the TV anyway. We didn't get the best seat.
Go to the board and shit. Because still...
I'm gonna take a walk over and see if I can see your name on the chat.
That's fresh right there.
It shows the surgeon. And there's Kevin Neal and RA for Ryan Alexander. You're in the operating room. And there's Mama, waiting patiently.
Here's all my change.
Daddy's adding change to your bag of money.
So you guys can get some Cokes tonight.
Yeah. So, what have we been doing while we've been waiting?
We've been doing a lot of walking and talking and drinking a lot of coffee. That's about it.
Yeah. So, hopefully you'll be done soon. It's like 11:30 or so. Love you, baby.
Love you, bye.
Hey, we just spoke to your doctor a little while ago and found out that you're in recovery. And he gave us this little picture of you laying down, your x-ray of before and after. So he said we'll get to see you soon. Love you.
So I just paused the video, and these are the immediate results, I guess. And to be honest, that's pretty dang awesome. The problem is you're constantly laying down. So I actually had this experience when I was in the hospital. I started walking, and I was there for maybe like 5 days or something. And I got up the first day and I checked my height. I was like 5'5". And then right as we were about to leave, I was 5'4". Like I don't know if it's just because you were literally laying down for multiple days that rope thingy was really kicking in. I really don't know. But for like a before and after of like a surgery, that's pretty dang incredible, at least in my opinion. So yeah, that's that's all I had to say.
So I'm right at 20 and it's like
Probably
a
like
little bubbly.
So do you remember anything about the operation?
Yeah, they were moving me around. They like did a little dance.
Oh yeah?
Yeah.
That's
It's
cute.
crazy. No, I'm just kidding. Is this my room?
Yeah.
I think so.
Thank you guys so much.
Okay.
All
Looks like
right.
you get to hang out here for a couple days.
Yeah. This will be your spot for a while.
And there's your big TV.
So, if you post this to YouTube and other kids can see this, what do you want to tell them about how you feel?
Pain.
Maybe-
Right now, at least.
Yeah.
And what hurts then?
Well, it's kind of just more of a breathing thing.
A breathing thing.
If I could breathe a little bit better,
Gotcha.
that make things tend to be better.
All right.
I don't know if I'm even making words.
You are.
Yeah, yeah.
Okay.
All right. Well, do you want to get some rest?
Have they done the cord with like, so like when I pee?
Yes.
Yes.
Cap-
Oh my god.
Yeah, so you've got a catheter in, so you won't have to pee because it's draining your bladder for a while.
Okay.
Okay, so you just relax. Today is relaxing day.
And you were right, Ryan. You did your homework. Tonight, it's just sitting up. You don't walk until tomorrow.
Yeah.
I called it.
You did.
You did.
You did your homework.
Booyah shot.
All right.
Good job.
Turning it off now. So that beeping noise, tell me what you're going to do to it.
I'm gonna beat the crap out of it. It's so annoying. I literally want to like,
Karate chop it?
yes. It's like, especially when I move around, it's like all over the place. And it's like, shut up. But at least I got a sexy man voice.
Maybe you ought to hit the pain button again.
Some of the nurses have already started flirting with me. So, I'm pulling big gains over here, but I'm in a lot of pain.
And you're already on the phone.
Hey, at least you know they're making money.
Yeah. And one thing I gotta say, since ever goes on YouTube, the pain medication may or may not work, but that's when the Tylenol comes in, or what is that?
Ibuprofen.
Ibuprofen. And they give you a big dose of that, and that's to help you calm down.
and stuff.
Maybe you ought to press the button and see
You
if it
press the
works.
button and see if it makes you feel better.
Oh,
I got a little beep.
let's see what it says.
Should say delivering.
I think it's been 10 minutes.
Jeez, I probably look like crap.
No, you don't. You look just fine. Maybe it wasn't 10 minutes.
It's like,
All right.
delivering.
Yeah, maybe it wasn't. So it's set for every 10 minutes. So if he wants a hit of the medicine that makes him feel better, he presses the button.
That's what I look like. Oh my gosh. I can just say I had a bad hair day.
I think it looks perfect.
Oh yeah. You want to copy me tomorrow?
If I had longer hair.
You should grow it out.
All right, I'm going to turn the camera off, let you rest for a little bit.
Alright. Love you.
Sing
You
the
gonna go
rap
back
for
to
us.
sleep now?
Uh-huh.
You going back to sleep or you gonna sing a rhyme?
It's a rap, but yeah.
Sing the rap.
Alright. Hey. So this is my life and I love it. Man, I have so much fun and I got stuff to do all my time. So much stuff. Man, it's not enough. Think I might throw up. Need to go and lie back down so I don't drown in my hurt and all this thing I do. I like to not have the flu and it's all for you and I need some stew which I have, but it's so good. Man, it's so good. It's so good. Man, I think I need some sleep.
So tell us about the pain today.
Tell us what's really hurting you, because they usually say it's the chest tube, but what is it?
Not being able to breathe. So like, if you breathe a certain amount, it really starts to, you get like this pain sensation. Okay, hello. Hey, this is a quick little editor's note from my narration. I know that's kind of weird, but I realized how bad of a job I did narrating over this. I paused the video here to explain that I still, to this day, have problems because of the surgery. At least I think it was part of the surgery. I still have this popping feeling. It's not like, even with this popping feeling that I get, I'm still very happy that I got the surgery. I don't know where I'd be now if I didn't get the surgery, but that is still something that you want to consider, that not, how do I want to say this? The problems that at least I had, which is basically every once in a while when I breathe, I kind of get a pop feeling by my hip. It was still worth it to have the surgery, and you just gotta inform yourself about that type of stuff. It could happen to you or it could not. I think the reason why I get like a pop sensation is because a ligament is like rubbing against a bone of mine. I tried telling my doctor about it and he said he didn't know what to do, but I'm sure, I don't know about mine, but you could definitely research all the problems that you do end up getting and you might be able to fix them as well. So even though this is something that's been happening for over a year now, which is crazy to think, it is something that I could probably still fix if I wanted to. If I really, I'd probably have to get a new doctor or something. But yeah, I just wanted to say that because I didn't want people to think that like I'm perfectly fine and everything. I want to inform people truthfully what the results are from this surgery. And unfortunately, I do have a pop feeling that I get a little bit. But if you do little breaths, just a lot of them, it helps you cope with the pain, along with sitting up straighter. For some reason that helps.
But tomorrow they're going to make you blow in that tube, so you're going to have to take deeper breaths. I think the short, shallow breaths are good for today, but tomorrow they're going to make you breathe.
because they want you to work your lungs.
Yeah.
Oh my gosh, I think I just popped something. Well,
Oh.
that's it for right now.
No, but you were saying something about one side hurts more than the other. What were you saying?
The side that they did the surgery on hurts.
Well, that makes sense.
And then I've had muscle spasms on the other side. Now it's been pretty light, so you know that's kind of expected.
It's bearable.
Yeah, that's not the worst part. But if you just distract yourself with the TV, and then when you don't want to watch the TV, you take a nap, it makes things a lot better than just not doing anything at all.
Sounds good. You signing off now?
Yeah. Or if it's just like,
So what were you saying about breathing?
so if you breathe more in your stomach,
With your diaphragm, as opposed to your shoulders.
it makes it a lot easier to cope with the pain. But I've noticed if you do that, just like breathing a lot more, even with your shoulders, you tend to feel like movement. And I don't know if that's good or not, so I don't know if I'm hurting myself. But I'm assuming that is helping with my scoliosis somehow, you know. I guess getting it into a better position. Recording.
All right. Well, this is the next day. Tell me how you feel. How did it go last night?
Kind of crappy.
Yeah.
So, I was in a lot of pain. At first, they flipped me on my side to, I guess, just so my back was moving a little bit. But I'm not really sure why they did that because
Well, you don't want to stay in the same position all the time. That's
Yeah,
not
but-
good for your body. You get bed sores.
after a while, they just flipped me back on my straight across.
Well, no, that's fine. I'm just saying you don't want to stay laying on your back the whole time. You'll get bed sores. But anyway, so what else?
Yeah, but anyway, so I was kind of in a lot of pain, and breathing was a lot harder. I actually just got told by a doctor that came in here, and he said that, you know, not that I should take shorter breaths, but it's more common, and that, you know, like, I should pace myself. And the bigger breaths are good because it's helping me, but I should always take it slow and steady.
Mm-hmm.
So
Let's show them your chest tube. Oh, wait. Ryan loves his socks. So because they deflate the lung, let's see. They gotta get all that stuff out of there. And this is, you see there's a lot coming out. The harder breaths he takes, he gets like these little streams of blood that come out.
I
And-
can demonstrate.
Yeah, well, hold on. What I'm gonna do, I watched the nurse do this just a couple times. Just to get this in the bucket. Okay. Alright, so you want to take a deep breath?
Do you see it?
It may be up by your side still. Well, no, don't move your tube.
I don't think it matters so much. Do you see it up by my...
Nope, it looks pretty good.
Oh, maybe they cleared it all.
This is not going to be a very good video. I apologize. But normally that's what it is. It'll cause a little bit more blood to go through the tube.
It's the best video. It's the greatest video.
Well, we are just trying to tell truth here. We're not trying to sugarcoat it. But What did you decide? You decided you didn't like the narcotics. You like the what better?
Is this the narcotics? What
So
is this?
that Jeopardy button gives you like morphine.
Like Jeopardy button.
That's what they call
We
it.
call it a Jeopardy button.
That gives you the morphine.
And so you press it, and then you act like you're gonna answer with the question or whatever.
Yeah.
You-
But do you like that better, or do you like the ibuprofen?
This doesn't do so much, but the ibuprofen
The
doesn't.
Tylenol, the megadose Tylenol.
It doesn't do as much as I thought. I thought it was going to kick more, but it kind of.
Which one you thought was gonna kick more?
Both of them.
Oh, okay.
But it with the Tylenol and the whatever other one,
Like the ibuprofen.
the ibuprofen, it kind of sinks in, so you don't really like as you kind of slowly feel a little bit better, and then it kind of goes away, and that's when they do it again. So really,
Yeah, because you're switching off every 3 hours.
yeah, so really when they're putting it in, you feel a little crappy, and then it gets better, and then it's just slowly healing over time. And yeah, it's definitely like a on and off feeling. Like sometimes you feel really good. I also realized if you sit up and down more, it really helps. It's like laying on one side of the bed, if you flip over, you feel a little bit better. If not, you start to like kind of get uncomfortable. So if you sit up like this, and I think I already said this before, but if you just watch the movie, it helps you get distracted, and it makes it a lot easier. And I've been drinking a lot of ginger ale, so that's been good. Been enjoying that.
Alright, we're gonna sign off for now. Let him get a little more rest. You got okay rest last night though, right? You did get some sleep?
Yeah, until the doctor woke me up. I had a
Oh, and the
good-
nurses do too. They come in every so often and
I had one, I'd say, good 2.5 hours sleep, which doesn't sound like a lot, but like, it really hit me in a way that was like really positive. So.
alright, sounds good. Alright, we'll see you when you maybe start walking.
Oh gosh.
Yeah, walking today. Alright, we're out. Tell us all about the catheter. So start with, you weren't excited that you were getting it.
Like from like the very beginning, like when
Yeah.
I realized I got one.
Like when you realized you were going to be getting one.
Yeah, tell us about today. What you said to us about the catheter today.
It was uncomfortable.
It was uncomfortable earlier, so then the nurse came in.
Yeah. And then he took it out, and that was like really bad.
What
yeah,
did it
but
feel
now
like?
don't scare people. It was bearable
Yeah.
though, right?
Well, what did it feel like?
It was bad.
Okay.
It felt like something. So the way they explained it is they said they deflated something similar to like a balloon. If they didn't deflate it, then it would have hurt a lot more, obviously. But so they deflated something, and I thought it was gonna be like a hurt in one area pain, but as he pulls it, it hurts. Like the pain is moving with the tube.
That makes
So-
sense.
So you can feel it
So,
going.
yeah, so
coming
like
out.
the pain would start right here, and then as he pulls up, the pain hurts more and more. Yeah, it does that.
But also
Yeah.
keep in mind that you started counting from 10 backwards and you only got till 5 and he was done already. So even though it was painful,
It was quick.
it was quick.
It was quick, and he says that you are gonna feel the urge to pee, but
At first.
you're not gonna be able to pee because you just got drained. But it did hurt.
that wasn't the most enjoyable thing,
Of course.
I gotta say.
Okay.
But it wasn't that bad. And I,
But-
done.
I got socks
To be
and a hat.
fair, you did say yesterday that it was pretty cool to have it because it was very convenient. You didn't have to get up and go to the bathroom.
Oh yeah, I'd much rather do that than have to get up the same exact day during the surgery to go pee. So
Yeah.
it's definitely helpful in that aspect. And I got cool socks. And yeah. I don't think that hat fits me though, but you know what?
The socks might be kind of small too, but
Well, I thought these socks were small
yeah,
too.
they are.
They're
It'd be
pretty
like
decent.
the ankle socks like people wear nowadays. The ankle socks.
Yeah. All right. Well, we're
All
gonna
right.
sign off for now, right?
Yep.
I know, right?
All right. Ryan is walking.
Day one after the operation.
How's it feel?
Feels weird.
Yeah. Take your time though.
Got his underpants on, and I was walking to the bathroom.
Are you getting my good side?
If your butt's your good side.
Okay. We'll let Courtney go in first.
Hey.
Oh, there we go.
Oh, nice.
So they came in and helped Ryan put on some underwear and walk to the bathroom and brush his teeth and do some like arm motions. And now he's sitting in a chair and he's actually eating real food, it seems,
Yeah,
instead of just
solid
the
food.
solid food instead of just the clear liquids.
Got some graham crackers here,
Yeah.
Some cheddar, popcorn.
some popcorn.
So how bad was it getting out of the bed and getting up? Bad, good. Now you're a gymnast, so you've got some pretty strong abdominal muscles. What do you think it would be like for someone who's not a gymnast? Do you think it would be hard?
Well, it just depends on the person. Like, you really only feel it where you're in your back. You get this dizziness, and the slower pace you work it at, it helps you, but that's kind of,
So like getting out of the bed normally
yeah.
in the front, but it just hurts more in the back.
Like it's only hurt me on my side really, and then
And that's where your chest tube is.
I think just moving causes your body to almost like kind of tingle a little bit. Like it's just a new experience or just like something that you haven't done for a while. So it definitely feels weird, but after a while, it's mostly just dealing with your head kind of figuring out itself and your body just feeling pretty sore. So
Yeah. All right, so we're waiting on lunch to
They
come.
also said about you want to be up, sitting down, and moving to help get all the blood out so they can get the
chest
tube out of
tube,
you
yeah.
quicker.
yeah, the more you move, the quicker it's gonna be to get this chest tube out, and just being in different positions always helps. So,
All right, signing out.
see you guys.
What is today?
I have no clue.
Today is, for us, you had your surgery Monday morning.
Wednesday.
Today's Wednesday, so what we wanted to do was show you what the chest tube kind of looks like.
Yeah, it's disgusting.
Yes.
That's it right there.
Yeah, don't touch it. And that's where I guess one of your scars are. You want to lift your. So his arm hurts because I guess it was up during the surgery, and
Yeah.
his physical therapist said he needs to be working out that arm. But, oops, sorry. Show me, kind of. Can you curl over so I could see the back a little? Yeah, that's where some more scars are, or I mean, where the incisions were. But you slept good last night?
I slept decent, yeah.
And
then
you're getting up and going to the bathroom because we got the catheter taken out.
the the coughing and the peeing have been the most difficult things to do. And I haven't tried pooping yet.
All right. And what makes the peeing so difficult?
Cause it's like it just doesn't want to like cooperate. Like I don't know. You gotta,
Because you
like,
had the catheter in there,
yeah.
and now you don't.
Yeah. You have to like do all the little things that help you. Like you have to have the water running, and like it makes it easier if you touch water. And then I normally like close my eyes and then I pee for a little bit, and then it's like it goes away. And so it's a lot of waiting, but they said that's okay.
But you know what? I think what you're really having is just that sensation that you need to pee and maybe you don't. So that's just gonna have to come back with time.
No, because I do end up peeing. Like I would end up needing to go use the bathroom, then I would feel it, but it just doesn't want to come out. So
Yeah.
but that's definitely due to the what do we call it? What is it?
It was a catheter, but they called it something else. But I'm pretty sure it was a catheter.
Yeah, they call it something else. And then I've been taking some Miralax.
Mixed in with his Gatorade.
Yeah, I got orange Gatorade.
And I don't remember if we told him that you're now eating solid food again.
I am eating solid food.
Yeah.
And
Let's tell him. So the general surgeon came in to check his chest tube yesterday, and we had a little issue getting up to go to the bathroom, and it kind of tugged on it a little bit. So
oh yeah, blood spilled.
Blood spilled a little bit. So what? I don't exactly understand the terminology, but they've got him plugged in so that there's some sort of suction going on with the chest tube as well. But that meant that we couldn't practice walking today until, the doctor comes back.
Okay, so I paused it again. Your whole time there, at least for me, it was based on, getting all that fluid out of your chest. I could have probably left a day, maybe, I don't know, maybe even 2. That might be a little bit of a stretch, but we were planning on leaving earlier, and because of the chest tube, we had to stay longer. And that was just because I wasn't getting enough fluid out of my body, or like too much was coming out still. So for me, I felt physically capable of getting up. When I walked, while it was hard, I was able to do it. I felt hurt, but it was doable. Yeah.
To check on that, which we're just waiting on him to return.
Yeah, once again, it's just mostly been this side, everything else. If you almost like focus on your feet, it makes it a lot better. If like, especially since I've had these socks, I've literally had these socks like the whole time I've been here.
Well, yeah, because they don't want you to slip on the floor.
Yeah, and if you just kind of like focus on them, if you just play with them a little bit, it helps you to kind of forget
Distract
about the pain.
yourself.
Yeah.
But according to the physical therapist, I guess sitting in the chair really kind of helps,
The blood get out of me or whatever.
right. So we're going to sit in the chair for quite a while today, I think.
Yeah, definitely, because it, you get used to it after a while, like sitting in one spot. Now they always want you to move, but it's better to sit in the chair than it is to lay in the bed.
Yeah, well, because when you lay in the bed, what happens?
Not a lot of stuff comes out.
Yeah, and you fall asleep.
Well, falling asleep is good.
Yeah.
And just fall asleep on here. Yeah.
All right, ready to sign out?
Yeah.
Okay.
Little thing in between those 2 arrows. So slow and steady. Breathe in as much as you can. Breathe in.
I got so much pressure now.
And then let go. And then you're gonna do it 10 times every like so if you're watching a TV show, like when commercials come on, that's when you would do it. They say about 10 times an hour.
10 times an hour.
Doesn't have to be back to back.
I still got food in my mouth.
Swallow it, goofball.
Take a swig. Come on.
What was that? Basically hit me hard.
What does that mean? Hit you hard.
Well, you should chew your food instead of just swallowing it.
Did I breathe in?
Yep. There you go. Oh, but you want to keep this in between those two. So you want to do slow and steady. Yep. See? And the goal is to make you cough. That's why we do it. Have to take deep breaths.
How high is it supposed to go? Is it
This
supposed to
thing?
go all the way here?
You won't be able to make it that high right now. No,
What-
we just
what-
want
what's the-
around here if you can. But don't. I don't think you'll be able to do it today. I don't want you to hurt
Oh, that's a
yourself.
challenge?
I don't want you to overdo
No, no,
it
no,
today.
no, no.
It's not, because if you overdo it.
I'll get it to here.
All right. Slow
Watch
and steady the whole
yourself,
time.
don't kill yourself.
Then he's gonna take it out of his mouth and he's gonna choke. He's gonna go, "Where's my pillow?" Nope. It's falling. It's falling.
Oh, dang. So close.
That was not close to here. Typical male. So
I
close.
started off pretty dang
You
good though.
Mm-hmm.
It was like right in the middle, wasn't
You
it?
did.
I got it about this long.
You can do it. Don't overdo
This is
it.
the only thing I'm gonna be doing now. It's like a game to me.
You're gonna get lightheaded now. What'd you say?
Snap.
Snap.
Difficult. It's harder than you think.
I feel it in my hips. Are you supposed to feel it in your hips?
Are you
I don't
breathing
know
from
about
the
that.
right place?
Dude, I don't know. It was just flowing.
You're breathing from your hips.
So Ryan has a new toy to play with. It's supposed to help his lungs.
Now you're doing eating all together.
I think he wants to finish the thing, but he's intrigued now. He has purpose again. But you have to keep the ball in that.
Right, in between the two.
I've been doing that.
That's not what I saw, son.
Well, yeah, you saw the blood thing at 500, and it was at
Okay, that was
380.
because there was a shadow on the thing.
Yeah.
Stop talking smack and do it. Come on, bro, you got this.
About to do it.
I got this.
This is the one. This is the one.
All right, let's do it. Prove me
All right.
wrong.
I will.
Do it. Do it.
Okay.
Ryan. Ryan.
So maybe go
He said, "Oh
slow.
my God."
So
Like I
close.
said, slow and steady.
About halfway.
That's what he said last time. Oh, I can do this.
That was less than the last one.
Oh no, because I'm trying to
Trying
find
to
out
what?
I'm
What?
trying to find out the strategy in it.
Oh, okay.
Slow and steady is the
Maybe
strategy.
if I dig my
The
finger
strategy
into
is
it,
you have to get your
Just do it
lungs.
slow and steady. It's static strategy.
like that. It's like the it's like a wizard. It's like that worked. That was pretty high.
But what is that?
I'm just gonna breathe. Just never put my. I'm just going.
Hey, I'm in 4.
Oh, that hurt.
Thank you.
Okay, I think I'm done.
Bye.
What am I supposed to be talking about
I
again?
thought you said we were going to talk about PT, so
Okay,
you
so
did your
my-
PT today.
I did my PT physical training.
This is Thursday.
Yeah, today is Thursday.
And you didn't do it yesterday because you were connected to the wall. You had to have suction.
They didn't know if they should allow me to do PT due to the suction thing, but they said I could, so that's what we did today. I went up like a half a flight of stairs, and I went back down. That seemed really easy. And I actually walked a little bit more than I needed to because the student really wanted to keep a conversation. But, you know, it was cool. I got to move around a lot and get out of this room, so. And then what else?
So the general surgeon just came in to check your chest tube.
And he said,
Okay, hello, it's me again. I paused the video. I'd just like to say before I kind of talk about what I'm about to talk about, I have the AC literally running right onto the microphone, basically. I tried moving it as much as possible, but I'm sorry if it sounds a little bit worse. But anyway, I wanted to explain to you guys how important it is to not twist your body when you have this surgery. It very much will hurt, and it's a pain that you probably have never experienced before. And that is the reason why they get you out of the bed a certain way. That is the reason why they, it takes a little while. I mean, there's other reasons why you have to wait, but that is one of the reasons, the pain from just anything in general. But the twisting pain will catch you off guard. It happened to me. It might happen to you. You just got to be very careful about it. The day I left the surgery place, hospital thing, I'm getting hiccups now. The day I left, my dad drove me to Taco Bell. We got some Taco Bell. And I was getting out of his car, and I twisted my back, not thinking, and I shouldn't have done that, and it hurt. And you might accidentally do that. It's going to freak you out, but do not be worried. Do not think, oh, I just broke the rope. Just don't twist on purpose, and be very careful when you're moving in general. At least for like a week, 2 weeks straight, you're going to have that pain, and it's going to get better, but you do not want to twist at all. And also take your medication. They give you medication at the end when you're at the house. Take it. Make sure you take it when they want you to take it. What I did towards the end is I broke the pills in half. That way it was more of like a gradual thing, because eventually you're running out of medication and you're still going to be in pain after, I would assume. I think that's what happened with me. So yeah, that's basically what happened. I talked a lot. I don't know how much more I'm going to narrate over this. It's pretty self-explanatory, like what I say. I'm explaining things better now because I'm actually able to talk. So, yeah.
I was emitting a lot of fluid, but they're going to take it out anyways.
Oh, sorry.
That's all good.
Doing a documentary.
Yep.
Yeah.
Cool.
Good. So, let's try to find.
So what have you heard that it feels like when they take it out?
Weird. It's gonna feel weird. Like, I swear, I think it's gonna be a popping noise. Like, that's what I think is gonna, there's no way a tube's just gonna come out without, I don't know, I just think that's what's gonna happen, but, and then they're gonna, keep me on, a 4-hour watch, is that what they said?
Yep.
And then, hopefully I do good when they're watching me, spectating me, and yeah.
Make sure that your lungs don't hurt any worse than they already hurt right now for 4 hours,
Yep.
and then you can go home.
I'm sorry, what?
How you doing?
Hi.
Okay.
Oh, come on in. Come on in.
Brain fluid
out of his brain.
They're sucking the pee out of him, and that's why he couldn't pee.
It's sucking the pee out of me. How's it going? I haven't been able to hold on to the camera for a little while because I've been hurting, but this is my first time, and I'm doing this because I'm just waiting for them to come back here with the people that are going to take out the chest tube. I didn't get to fully explain it because a nurse came in and she wanted to ask me what I wanted to eat. But basically, they're going to be letting me lay on my left side because the tube is on my right. And they're just going to pull it out. And I don't know how that's going to feel. They said it felt weird. Or it feels weird. And then they're going to be monitoring me I think that's it.
I want to train you for 4 hours.
4 hours. The whole 4. And then my mom is... Oh, there's my dad. My mom is slacking.
She's never on the phone.
She's never on her phone. No. She's been a big help. I always end up pissing her off because I always have to go to the bathroom at like 2 in the morning. And I always have to yell at her. It's pretty funny. But, yeah. I should hopefully be leaving today. And then I can wrap up this whole thing when I get home. So, yeah.
When you're feeling good, you're feeling good. So thank you. I so appreciate it.
Thank you. Can you do a princess wave whilst riding in the bus? Thank you. Thank you.
Wait, now when you get to the end of the hall, you guys have to switch positions.
No paparazzi, please.
There they go.
Party bus is the best.
They redid that like Tuesday, and so but they're required to be by 6 day.
Peace out.
She was bad. She was what they did.
So this is what you do when you were told at 10:30 that you're gonna get your chest tube out, and it's 2:30. And then once you get the chest tube out, you have to wait 4 hours. They have to monitor you before you go home. So hopefully we're going home today, but it's starting to look like that may not happen. So we'll keep you posted. Nighty night. Okay, so tell us about the chest tube. It came out.
Yeah, it did. I had to practice my VBT.
Okay, so the chest tube is out. Tell us about that.
Is it recording?
Yes, it's recording.
Okay. The chest tube. I had to do. What do you call it?
Exhale.
Yeah, I had to exhale. I had to do breathing routines in order to get it out. So basically, he would count to 2. On 2, I would start to suck up my breath, and on 3, I would hold my breath, and then he would just tell me when to release it. So basically, when I guess I was releasing, I couldn't see him actually pulling anything out, so I don't know.
Yeah, because you were rolled over on your side.
Yeah. So did he do it so when he said release, he pulled it out?
I don't know. I came in the room after I had run downstairs to go get something.
Well, I mean, it wasn't that different. It wasn't painful at all. It was a little weird, but it's not weird feeling. It's more of the tape removing was weird feeling. Because we didn't use the normally they give you some spray that makes it easier to take off the tape. It was just the tape that felt weird to remove. So yeah, there we go.
He found the spray after he took the tape off.
Yeah, after we took all the dang tape
The
off.
bandage off.
Oh.
So
Yeah, that's good spray stuff because it doesn't
Maybe we
rip
could
your
take it
skin
home
while
with
you're
us.
trying to take it
steal
off.
it.
No, it's yours.
No.
I'm sure you've paid for it.
What are we ever going to use it for? Oh, for the other ones that he's got. That's true.
Yeah.
Yeah.
All right.
My manly scar.
Put this back.
So, what did they say? So, we got it taken out. We have to be monitored for 4 hours and then we can start the discharge process.
Yeah, and then I can leave.
And then we can leave. We'll do one last one, I guess, before we go and you can sort of wrap up the whole experience. That sound good?
Yep.
Peace out.
Okay, I'd like to say something, and I know this is going to be very hard to put into some people's minds, But this surgery, while it is a super big deal, just try not to worry about it too much. I went into this. This was my first surgery, and I was freaking out. But do not be afraid, and do not be afraid if something whack just happens. Like all surgeries, nothing is perfect, but it's likely that your surgery will be just fine. I wish everyone the best if they do decide to get this surgery. I really hope that everything goes well. There are Facebook pages and groups and social media gatherings. There's other videos that you can watch. Do not be afraid to talk to people about this and get some help. I mean, just knowing that other people have done this is very helpful, and you can, do this. It's something that's gonna suck, but you definitely can do this. I wish everyone the best. Good luck if you're getting the surgery, and thank you for watching the video. I wish everyone the best. Go out, enjoy yourself. Dang, how do I say this? I wish everyone the best, and have a good day.